And we have this breaking news. If you thought the GOP healthcare plan was DOA, listen to this. Majority Leader Kevin McCarthy now confirming that the House could vote as early as next Thursday on the GOP's Obamacare replacement bill. So to give you a little perspective on this, they probably wouldn't hold a vote if they weren't confident they had enough votes. Could it have been the art of the deal that's getting them the votes? President Trump chipping away one skeptic at a time, maybe. He met this morning at the White House with the Republican Study Committee, and then came this.
All of these no's, or potential no's, are all yeses. Every single person sitting in this room is now a yes.
After 15 minutes, now in all fairness, it's not 15 minutes, it's really after about 4 or 5 days, but after 15 minutes, they went from no to all yeses. So the health care looks like it's going to be in great shape. It's a great plan.
Well, what about Medicaid? Was there give and get on that? The Medicaid point man for all governors, some of whom are very concerned about losing Medicaid coverage for their poor and elderly. Matt Salo, he's the CEO of National Association of Medicaid Directors. It's great to see you, Matt. Thank you.
Great. Thanks for having me, Liz.
Okay, first question. Do any of these gives, anything that you've seen, leave Medicaid recipients covered beyond 2020? Because, listen, this plan is supposed to phase out the Medicaid expansion by 2020.
Yeah, well, I think, what we see coming out of the House, the answer looks like no. But what's not being talked about here is what is going to happen in the Senate. And I think from what we see in the Senate from moderate Senate Republicans, senators who are in states that have done the Medicaid expansion, they are extremely worried about the House bill pulling the rug out from underneath them on the Medicaid expansion.
Okay. Listen, today, 4 Republican governors, and you're the guy that is that point person for all the governors. 4 Republican governors from states Donald Trump won sent this letter. Michigan, Ohio, Arkansas, Nevada, and the letter was sent to the leaders of both the House and the Senate. And here's what the sort of crux of it was. We were encouraged by the president's joint address to Congress when he established his principle that we should give our great state governors the resources and flexibility they need with Medicaid to make sure no one is left out. This, unfortunately, this current version of the House bill does not meet this test. What would?
So I think what those governors and what many governors are really looking at is to actually find a way to allow states to tackle head-on the underlying cost drivers of health care and of Medicaid. And I think what you see out of the current proposal is an $880 billion cut in spending. And it doesn't really address what some of those very, very difficult and thorny real health care problems are. The high cost of pharmaceuticals and biologics, the high cost of nursing home care, long-term care more broadly, care for people with disabilities, the opioid crisis.
I know you're not a politician, but you have certainly dealt with many politicians, and I'm just wondering, these are states that Donald Trump won, and states where there are a lot of poor people, a lot of unemployed people, and they voted for him because they felt that he could do something great for them. He may be the one that wants to help out on that case, but it appears that the Freedom Caucus, the very conservative group there, they would like to see it phased out immediately. And so I don't know how this thing gets passed if they remain intransigent.
If they remain intransigent, it probably doesn't. I mean, I think the great thing about governors and the state Medicaid directors that I work for is these are extraordinarily pragmatic and extraordinarily compassionate and hardworking people. And they're trying to make the Medicaid program work as well as it can, to be as effective and efficient as it can in improving health care outcomes for people, while at the same time being a responsible steward of the taxpayer dollar.
Yeah, well,
and I think what you're seeing in a lot of these conversations isn't terribly pragmatic or practical.
Well, listen, even people receiving Medicaid need to be pragmatic, and I think one of the giveaways and the gets was that Medicaid recipients who are able-bodied must work. They must work in order to get something. You know, you give, you get. All right, listen, Matt, keep us posted. It's a very, very big sticking point right now, Medicaid. Matt Salo, National Association of Medicaid Directors. He's the CEO. Closing bell.